You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. On this week's episode, I spoke with Yitzy Wax, a therapist who specializes in behavioral challenges in children, including the main subject of our discussion, which is Oppositional Defiant Disorder, also known as ODD, which commonly comes along with ADHD. I occasionally work with teenagers who have this combination, and as an ADHD coach, I treat the ADHD side of things, but I met Yitzy at the Nefesh conference this year. When he told me that he specializes in ODD, I was excited to learn more about it. I hope you are too. We discussed what ODD is and what it is not, what it comes from, the different situations in which it can present, what practitioners do for treatment, the role parents play in the process, what it looks like when a child has both ADHD and ODD, and a lot more. Shout out to the Chinuch Today podcast with Rabbi Yerachmiel Garfield, where he discusses innovations in the world of education with those who are already implementing them. So go check that out if that speaks to you in the way it speaks to me. Before we go to the episode, just a heads up that we will be taking a week off for Pesach, and that's also why this episode is out early. So we will see you in a few weeks after that. In the meantime, I assume you'll be binge listening to all the older episodes. Now on to the regular episode. Enjoy! Yitzy Wax, welcome to the ADHD Heroes Podcast. I'm excited for our conversation today.
Thank you for having me. I'm excited to be here. And I've never been on a podcast before, so it should be fun.
Okay, great. Glad to be a part of that adventure and to be something that gets knocked off your bucket list.
There you go.
All right, so let's begin with a little bit about yourself and your background.
Okay, so I'm a social worker. I've been working for about 6 years. I think I graduated in 2020. My first job was actually at OHEL in Far Rockaway. I worked there for about 2 years. After OHEL, I started working in a school in Brooklyn called the Beacon School, which is a school primarily for from boys who have social and behavioral challenges. And I'm still working there. This is my third year. We have a bunch of social workers on staff. And then in September, I started working in a place in Far Rockaway called Premium Health, which is a clinic which offers therapy and psychiatry services. So I'm a part-time therapist here as well. And I would say, pretty much for the last, 3, even 4 years, I would say I've been working not only, but a large majority of the population I've been working with has been specifically boys. I only see boys with behavioral challenges, is what I refer to it as. And I didn't go into it specifically, to specialize in this area, but just for whatever reason, it's what Hashem hadn't planned for me. I just kind of been working with this population for a while.
Got it. Okay, it works out great for us because I'm super curious about this topic. So let's dive right into it. Our topic for today is going to be ODD. So what is ODD?
So what I would say is, before we get into what ODD is specifically, just to understand that in any disorder or any issue that someone might come to therapy for, everyone has a little bit of that issue, right? So there's an anxiety, there's something called anxiety, and then there's an anxiety disorder, right? We all have anxiety. It's a good and healthy thing for us to have. It's just when it gets too much, right, and what starts impairing our functioning, so you'd say that person has, generalized anxiety disorder or some sort of disorder.
Right.
So the diagnosis of ODD, I'll just add, there's ODD, there's also IED, which is intermittent explosive disorder, there's DMDD, which is disruptive mood dysregulation disorder. They're kind of like, I'll put them under one umbrella, even though there are differences. Specifically we're talking about ODD, but a lot of what we're going to talk about is going to be relevant to those also. So ODD stands for Oppositional Defiant Disorder. And it basically means when usually a child or a teen, that's when it's diagnosed, has a pattern of being oppositional or defiant, either towards a parent or some sort of authority figure. If you're interested, I have a copy of the DSM on my desk. I could read you the official diagnosis, the official criteria. You have to have one of the following: angry or irritable mood, argumentative or defiant behavior, and or vindictiveness. So, just to kind of put it into simple terms, it's, we all, any parent has a child that says no to them. Go get dressed. I don't want to.
Right.
And that doesn't mean that he has ODD or she has ODD, but
Right.
it's when it becomes a pattern, and when it's happening routinely on a regular basis for for a long time, let's say over 6 months, and it's persistent across the setting. So it's, very often it's specifically at home. Sometimes it's in school also or with friends, but very often it's coming up just at home, and in many cases also in school. But it's just a constant, defiance towards the parents, not listening, not following instructions, doing things like, being aggressive towards siblings, aggressive towards parents. That's what when the aggressiveness tends to come out most, towards siblings or parents, where, it's where the children are most comfortable with. So that's kind of in a nutshell what it looks like.
Got it. So and as you pointed out before, this has to be more severe and more persistent than the average, teenager just being a little obnoxious, as you pointed
Yeah,
out.
you
Yeah.
it's something that you kind of know when you see it. In other words, if it's kind of like a one-off, or if it's specific to a particular issue, if you're trying to get them to sign up for basketball, for basketball lessons, or and they're not interested, and you keep telling them, I want you to do that. That's not ODD, because they're just not interested in doing it. It's not like they're trying to defy you, or they have an issue where they're defiant. But usually, usually when it becomes a problem is when it's across a variety of things, and it's things that the parents need the children to do, right? Like, I need you to get dressed in the morning. I need you to go to sleep at night. I need you to take a shower. I need you to brush your teeth. I need you to not hit your siblings. I need you to not curse me out when I tell you to go take a shower. So those are kind of, um, things that are persisting over the course of the day. It's not just one issue. It's kind of a general trend that the child has a hard time, just kind of accepting the parent's authority.
Got it.
They're
So I'm
challenging that.
in contrast with ADHD, you noted that it can be in one setting, whereas for an ADHD diagnosis, it has to be present in different settings. I guess I want to ask why that is, but maybe I want to ask first the degree to which it would be neurological versus, or to what degree the neurological underpinnings would pair up with nurture. I guess do those all go together?
Yeah, so that's a good question, and I'll just preface that I'm not an expert like in the diagnosis part of it, but what I do know, just this is just more anecdotal in my experience, is that it is common for children with behavioral challenges to have it only in certain settings. I've seen that a lot where, even boys that I've had in the school that are fine in school. They behave like, they're not getting into trouble. They're following instructions. They're doing their work. And then you hear at home that, like, it's just total chaos, and the parents are, crying. They don't know what to do. It's not so that's not so abnormal. The reason why that is, I can't give a definitive answer, but just from experience, is that usually the environment kind of dictates how a child will do. So if you have a very kind of structured, and I would say rigid environment where the child knows the guidelines, he knows the boundaries for what his behavior can be, they have an easier time regulating themselves. Often it's at home where it's harder for parents, understandably so, to maintain structure, especially when there's a lot of kids, when parents are busy, and the rules are more lax, as they often are. Like, that's not a bad thing necessarily. Like, there are less rules at home than there are in school. You don't have to raise your hand to speak in at home,
Right.
and you shouldn't have to. But when the child has a hard time regulating themselves, and now you also have an environment at home where the rules are kind of lax, they have a harder time regulating themselves, and often that leads to more, dysregulation. I think I heard a good distinction between ADHD and ODDs. ADHD is they can't, right? They can't sit still. They can't focus. With ODD, and I would just encompass like behavioral challenges. It's not that they can't; it's that they won't for whatever reason. Not because they're a bad kid, and we'll talk about what the kind of the underpinnings of ODD are, but for whatever reason they're choosing not to. And I think that's kind of the distinction in my mind between the two.
Got it. So let's look under the hood a little bit. What are the underpinnings?
What are the underpinnings of ODD?
Yeah.
Sure. So there's again, I'm not an expert on like the biology and the neurology, but there is definitely something in the brain with the child who has ODD that's different from we'll call a non-ODD child. When we talk about what the causes for it are, we have to distinguish between why is it happening and what can be done about it, right?
Right.
So I think it would be wrong to say that a child is ODD because of what the parents are doing.
Okay,
I
that's good.
don't think I've ever seen a case where that's true. Very often you can have a family of 4, 5, 6, even seven kids, and only one of them has these kinds of ODD type of behaviors. And so that kind of shows you that these parents are very much capable of raising good, healthy, regulated children. And it's not that their parenting style is wrong or they're doing anything wrong per se, but there's something unique about this child that's gonna kind of require a different type of parenting. So there's something about their neurology that makes them, kind of need a particular type of parenting style or a particular setting in school or particular structure. But I certainly don't want to make it sound like parents are doing anything wrong to cause ODD. I don't think that's the case. That being said, I do think there are things parents can do to help their children who do have these challenges. So it's kind of like holding the two things at once. Like it's not your fault, right? And I'm saying this to parents, but at the end of the day, it's in your hands to make the changes that the child needs.
Right. You don't have to be a part of the problem to be a part of the solution.
Exactly.
So they say. Okay, what is the range of severity we can be looking at in school age kids?
So you can kind of divide it up into two categories. The first one is how in how many settings is it happening, right? So kids kind of have like 2 to 3 settings in their life, right? They have school, they have home, and they have kind of like play with with friends outside of school, the basketball court, whatever it is. So the more settings it's happening in is kind of one way of looking at it. Like if it's happening just at home or just at school, whereas if it's happening in 2 or 3 settings, that's one way to kind of visualize, how severe is it. But what's more visible to people on the outside is kind of how far their behavior is from the norm, right? So anyone who's a parent knows, kids will tantrum. They'll lay down on the floor and scream and cry, right? Hopefully, as they get a little older, they stop doing that. But that's normal behavior. It is also, kids will fight with their siblings. That's also normal to an extent, right?
Right.
They'll even maybe sometimes hit their parents if they're really upset. But the question is, are they able to hold themselves back from going too far, right? So are they able to not really, really hurt one of their siblings? Are they able to know, okay, I punched them, but now I got my point across, and now I'm gonna move on. I'll find something else, some other way of dealing with my emotions. So often children with behavioral challenges have a hard time, knowing that line that kind of other children are able to recognize, okay, this is going to be too far. I've already, gone as far as my parents are going to tolerate. If I do more, I'm going to be in a lot of trouble. I better stop. So, when you have children with behavioral challenges, very often their siblings are getting hurt.
Right.
Hurt can mean physically, having their teeth knocked out, getting a bloody nose, getting scratched. Very often it's not physical, but it's verbal. It's teasing. Sometimes it can be pretty relentless, and especially if they're a little bit older and they have the maturity to know how to tease in quote unquote an effective way, right? They know how to push their siblings' buttons. It can be devastating for a family because the whole structure of the family, the equilibrium in the house is thrown off because you have one kid that's sucking up so much attention. The parents are so focused on dealing with that one child, and the rest of the children kind of are just floating along because their behavior doesn't warrant that much attention.
Right.
But so I would say to the extent that it's disrupting whatever environment they're in is kind of the extent of how severe it can be.
At what point does a parent know this is strange? I should be reaching for help, calling for help.
Well, I think certainly if people are getting hurt, like the first question I always ask is, are there points in time where you're scared for either your own or your other children's safety? Right? That's like across the board. If the answer to that question is yes, then they need help.
Right.
And sometimes parents may or may not realize this, but if kids are getting hurt, other siblings are getting hurt, and they're not taking care of it, the issue may pretty quickly be out of their hands. If a teacher notices a bruise on one of their students' bodies and makes a report, then the issue might now it might snowball and become an even bigger issue. So but even putting that aside, just from a safety perspective, parents need to keep their kids safe. I think every parent would agree to that. So if safety is a concern, that's for sure. If safety is not a concern, but usually what parents will come in and say is, we're just in a constant struggle. Everything's a battle. I can't get my kid to get dressed in the morning. I can't get them to brush their teeth. They're never on the bus on time. I'm driving them to school. Everything's a fight. They won't do their homework. I can't get them to take a shower before they go to sleep. I can't get them to do anything without giving him screen time. The only way, I've heard that many times, the only way to keep this kid quiet is to put him in front of a screen. And parents don't like that. They don't want their kids in front of a screen for 2 or 3 hours. But it's just the last resort, because it's the only thing that's keeping their kid under control. So that's usually what has parents coming in, is that they're kind of frustrated with the way things are at home. To varying levels of severity. Sometimes it's not so severe, but they're being proactive and they want to make sure that things don't get worse. Sometimes parents come in when things are kind of they're at their wits' end. They don't know what else to do. So the idea would be for parents to come in sooner rather than later, because kind of the worse it gets, right, the more quote unquote out of control a child is, the harder it is to make changes. The earlier, before the child learns learns these behaviors, the easier it is, to change them quickly without needing a lot of time to work on it.
I got it. Okay, so turning to a little bit of a more positive side of things, what are standard approaches to addressing this?
I kind of take a two-pronged approach to it. The first part is, this is kind of like the not negotiable part for me. Like I don't know how to treat this without working with the parents. In therapy, especially when you start working with older kids, let's say 13, 14, tends to be just with the kid, and that works fine for certain issues. But when it comes to behavioral challenges, you really need the parents on board. It has to be an intensive treatment, with the parents on board. The mindset that I have, I'll just add, by the way, that most of what I use is not my own chidushim. It's not my own stuff. I'll tell you in a minute where it comes from. But the idea is, we're not really looking to change the child. That's really the bottom line. That's kind of holding the two things to be true, which is the parents aren't at fault for the way their child is, but they're also the ones that hold the key to changing the child's behavior. So the parents, if real change is going to be made, the parents need to be the ones to make that change. So that's kind of, sometimes it's a hard pill to swallow, to accept that my child isn't going to be the one that changes on his own. I can't just drop him off at therapy and expect him to change in a short period of time. It's going to involve the parents changing. The specific modality that I use is from a book from Alan Kasdan called PMT, Parent Management Training. And the basic idea is, we want to change the environment around the child, right? So our environments are reinforcing, right? In other words, they cause us to behave the way we do. So if we could change the way the environment operates around the child, right, we can create reinforcement for good behavior, and we can create punishment for bad behavior. Now, the word punishment is kind of taboo, a little bit in our society, but I always explain that punishment is not a punitive thing. It's not like I'm mad at you, so I'm going to punish you and take this away from you, or spank you.
Right.
Punishment is really just it's more of a technical term. It's you're doing a particular behavior. I don't want you to do this behavior because it's not a good behavior to do. So I'm going to put something in place, a consequence, to make it that you're less likely to do that behavior in the future, right?
Right.
So if every time you hit your sibling, you have to go, take a break in your room for 5 minutes, assuming the child doesn't want to do that,
Right.
the child's not going to want to keep hitting his sibling because he doesn't want to get the consequence. And the same is true for positive behavior. If you want to get our children to do something positive, right? So let's say we don't want them to hit their siblings when they're upset. We want them to come talk to us as parents, right?
Right.
If we're going to see that behavior of them coming to us and just kind of ignore it or just let it go and not reinforce it, they're not going to do it again because they're not being rewarded for it. So we have to reinforce the good behavior, what we call the positive opposite, right? We take whatever negative behavior we don't want, and we say, what's the opposite of that behavior? What's the behavior that you do want them to do?
Right.
And we really heavily reinforce that behavior. That's I can go into more detail, but that's basically the general framework for how the parenting sessions go.
Right. Got it. So what does that look like as far as, I guess, a couple of things. First of all, the kids needs to be taught a new system. I guess let's start with that.
Yeah, so it's a good question, and the answer is yes. It is a new system, and often it's a system that's specifically for this child, which is a little bit interesting for parents to think about because you might have 4 or 5 other kids, and they have their own kind of regular run-of-the-mill parenting style, and then this child is going to have a very specific and structured, tailor-made program for their behavior. It takes work. It takes kind of persistence to be able to stick to it. But the way, I guess if you want, I can give you an example for what a typical program might look like. So let's say you have this is very typical. You have a, let's call it a 10-year-old boy who's being aggressive towards his siblings and his parents, right? Now he's not just walking in the door and punching his parents in the face. That generally is not happening. There's some sort of reason, as a function, right, for the behavior. Most kids don't just punch people in the face for no reason. Like I've never seen that. There's something causing them to do that behavior. They're upset. Sometimes they're just bored and they're looking for a fight because it's fun. But there's some reason why they're doing the behavior. So we ask ourselves, okay, what's the reason? What's the reason? Okay, so his brother is bothering him. He's touching his toys. He gets annoyed. He punches him in the face. Okay, so you don't want your son, let's call him Chaim. You don't want Chaim punching his brother in the face. Okay, or punching anybody for that matter. Okay, so what do you want him to do when he's upset? You can't just take away the physical aggression because then you're leaving him with no outlet for his anger. Right? There's nothing wrong with feeling angry. If someone's touching your toy, you should feel angry. So we have to always go to what's the positive opposite. What do you want them to do, when they're upset? Okay, I want him to come complain to me. Come to mommy, tell me what's going on, and I'll take care of it for you. Okay, so now we know what we want them to do, and we know what we don't want them to do. So now the question is, how are we going to reinforce the positive behavior, and how are we going to punish? Again, not punish in a punitive sense of like I'm mad at you, so I'm getting back at you. Just in the sense of how do I get you to do this behavior less? Okay, so every time you punch one of your siblings or you're physical with them, you got to go to your room for 10 minutes. It's not a punishment. It's just you can't be around everybody else because you're hurting them, so you got to take a 10-minute break in your room. Now we also want to reinforce the positive behavior. So every time you come to me and you tell me what's bothering you, I'm going to make a little check on your chart. Every time you get 5 checks, you get a prize, right? And it has to be something that the kid is interested in, because if it's not, then it's not going to be reinforcing. So that's going to depend on each kid and how old they are and how often it's happening. So that's kind of the basic framework. And the reason why this works is because you're taking away all of the back and forth that typically happens when children do this kind of behavior. So let's say before the parents start this, what would happen, right? The parent would, Usually things would only start, the parents would only get involved once it's already crying, right? Chaim hit me. Chaim, why did you hit him? I told you 5 times, don't hit your brother. It becomes a fight. The parents are getting upset because this already happened 3 times. This already happened 3 times today. And now the parents yelling at Chaim. Chaim's yelling back. The whole house is kind of unraveling in chaos. So in some ways, this whole dynamic is actually very reinforcing because now Chaim's getting a lot of one-on-one time with his parents. It's a very emotionally intense one-on-one because they're yelling at him, which might seem like a bad thing, but really, kids want attention from their parents however they're going to get it. Right. And so this back and forth is very reinforcing to the negative behavior. So the goal is we're going to create a structure that the structure and the environment is going to help Chaim regulate himself. The parents won't need to do it for him. Right? So if Chaim knows that every time he's physical with one of his siblings, he has to go to his room, right? So now Chaim's going to have to make a choice for himself before he's physical. Do I want to go to my room, or do I want to find some other way of expressing myself? And generally in the beginning, it's going to be the first way. He's going to lose it. He's going to punch his sibling. But if the parents are able to stick with it and stay structured and stay with the system, and Chaim eventually sees my parents mean business. If I do this, I'm going to get this consequence. But they also mean business the other way. They also mean business that if I do the right thing, I'm going to consistently get rewarded for doing the right thing. Over time, he'll learn this. It's just better for me. If we try to, convince a kid, it's not the right thing to hit your siblings, it's an avera, like that's going to have no impact on them because, the vast majority of kids understand already that it's not a good thing to hit somebody else. It's not a matter of ethics. It's a matter of self-regulation.
Right. So if I'm understanding correctly, it sounds like the almost, I'll say consistency because that's where it's a plus, but the seeming rigidity.
Yeah, consistency, I would say, is the number one thing, even over rigidity, because it's not really about being rigid to a certain thing, right? The reward could be whatever, could be anything, as long as it's rewarding. The program could be whatever it is. It just has to be that whatever the parents say, they're going to do every single time. If the parents are going to punish a behavior 9 out of 10 times, the child's going to do it 10 times, hoping for the one time.
Right.
But if the child knows that every single time this behavior happens, the same consequence is going to come into place, pretty quickly he'll start making a different decision, because he's not interested in the consequence. And the goal isn't to have this system in place forever. The goal is for the child to learn the skills of self-regulation, and then over time to be able to phase it out to kind of a more typical and normal parental relationship.
Got it. How long does that tend to take, or does it vary from kid to kid?
Every child is different. It could take anywhere from a few months. Sometimes it could be longer. It really depends more on the parents than it does on the child. It's very hard for parents to stay really consistent and give it a lot of effort. Parents are busy. There's a lot going on. So it's hard to kind of really stay consistent with it. But I would say the most successful parents are the ones that really give it their full effort and make it a priority.
But it sounds more like a matter of months than a matter of, I don't know, years or something.
So when it comes to specific behaviors like physical aggression, it can be, sometimes it's even weeks. It really depends on the extent of it. How severe is it? In other words, if we're starting from a very severe place, so then it's going to take longer to to come down to the mean, so to speak.
Right.
But if it's kind of a typical, it could be weeks, it could be months, but sometimes it takes longer just because it's harder for the parents to implement it, or there are just, it's not always a matter of parents not being able to try hard enough. Like sometimes it's just logistically parents are not able to. They're just too busy. There isn't enough time, for them to be able to be on top of the child and implementing these plans, on a consistent basis.
Right. What do they do in a situation like that?
So it doesn't have to be all or nothing. It could be targeting just one or two behaviors. Usually if the behavior is severe enough, the parents kind of have no choice but to do something. Often it's when it's kind of like in the middle, when it's tolerable, but it's not going well, but they're not in crisis mode. If they're in crisis mode, usually parents are like, okay, I really gotta, I got to figure this out. If things are kind of going along, it's not great, but they're managing, then from a parent's perspective, they're a little bit less incentivized to prioritize time for it. But I've never met parents that didn't want to do good for their child. I've never seen that. Every parent comes in and wants to do the right thing for their child, and they're facing a really difficult challenge. Children with behavioral challenges can literally drive you up the wall,
Right.
and it's never ending. It interrupts your sleep, and it interrupts your Shabbos sudas, it interrupts work. Sometimes they're getting into trouble in school, and then you're really kind of dealing with it all day. So it's very dysregulating for parents. It's
Right.
very hard for parents. And I have a lot of respect for parents who come in for this issue, because it takes a lot of guts to be able to say, I have this issue and I'm gonna work on it.
Right. Awesome. I'm picturing a situation where the parent tells the kid to go to the room, but this is a kid who's got behavioral challenges, so he doesn't go to the room. And I imagine things like that happen. How would they address something like that?
So that happens all the time.
Right.
And the answer to that question is, it all comes back to the structure of the behavior program, right? So everything is kind of mapped out before we start, right? So let's say, going back to our example with Chaim, the parents say, Chaim, every time you are you're aggressive with one of your siblings, you got to go to your room for 10 minutes, right? So I can already tell them in advance before they start, Chaim is not going to go to his room that first time. It's just not going to happen. So two very important things have to happen. Number one, the parents have to know, okay, what am I going to do if Chaim doesn't go to his room, right? What we don't want is for the parents to have to ask him, 5 or 10 times and then he goes, because that's just a continuation of the power struggle and the reinforcement cycle. So there can be some sort of consequence for not going to your room, right? So if you don't go to your room, for every minute that you're not in your room, you're going to lose screen time tonight. So you have a half hour of screen time, that's yours to lose, right? So if you want to sit here for 10 minutes and argue with me and then go to your room, I'm not going to talk to you because you belong in your room. But if you want to sit here for 10 minutes and yell at me, no problem. You're just going to lose that time on your screen time tonight, or some sort of consequence like that. Again, coming back to the consistency, you have to do it every single time. And it has to be quality. It has to be that he cares about losing that particular reward, or whatever the consequence is going to be. The second part of dealing with this is a concept also from PMT, which is role play. This is kind of like a fun way for parents to help their child learn a particular behavior. And all it is they practice that behavior not in the real time, right? So they might say, Chaim, we're going to practice once or twice a day, you going to your room when I ask you to go to your room, right? So I'm going to, at a random, I'm going to choose a random time during the day. Let's say, 5:30 after you eat supper, I'm going to say, Chaim, go to your room. Chaim, you're going to stand up, walk to your room, and you get a prize, whatever the prize, they worked out in advance. And it kind of sounds silly, and it is. It's kind of like a game, but it's just teaching the kid that structure of, my parents, tell me to do something, I'm going to go do it. And it kind of starts that muscle memory of learning and reinforcing that behavior. And the idea being that when it comes time for the child to actually do it, when they're actually being told to go to the room, they're going to already have that kind of muscle memory of that behavior. And you can do this with any behavior. It could be brushing your teeth. It could be taking a shower. It's when you first start trying to reinforce a behavior, the behavior is not going to happen that often in the beginning because it hasn't been reinforced. So role play is just a way of practicing it in a fun way. Kids like to do it because it's an easy way to get a prize.
Right.
It becomes like a game, so it's kind of stress-free for the parents to do. It's an easy win for the kid, and all around it just helps reinforce that behavior in the beginning.
Got it. Does the negative consequence, should it feel like something that's a result of the behavior? So, for example, going to their room because they punched their sibling, that makes sense, because if you can't play nicely, then you can't play with anybody for just a little bit and come back when you're ready to play nicely. Is that a thing, or it doesn't have to be?
So that's what I refer to as a natural consequence. And I always prefer natural consequence because it just makes sense. It's easier for a child to understand. It's easier to explain to a child, when you're first introducing, the program or the behavior plan. It just makes sense. But that being said, there aren't always, easy natural consequences, and there's nothing wrong if you need to come up with some other consequence. But natural consequences are they're not hard to come by. Like if you smash something, you got to pay for it. If the child has money, or you got to make it up some other way. If you don't have money, so there's usually a good way of coming up with some sort of natural consequence. If not, then there are other options.
Got it. So moving on to adolescence, do things change at that stage, 15, 16, 17?
So things do change, but not really the underlying mechanics. It's more just in how it presents. So a 16-year-old is less likely to lay down on the floor and start crying and screaming.
Right.
But that doesn't mean that they're not they don't have the underlying issues of self-regulation. It just comes out in other areas. So they might be coming home late, without permission. It might be they're sometimes stealing money. Very often, they'll blame teachers. My teacher hates me. They're often the ones getting sent out of class on a regular basis. Unfortunately, very often, and this isn't a fault of schools, but teachers often have a hard time. Teachers generally have a hard time with children with behavioral challenges in school because they have a whole class to deal with. Teachers sometimes have 25, 30 or more kids in a class. They don't have time to start individually creating behavior plans for one child. So often, unfortunately, these kids are kind of roaming the hallways, not in class, because the teacher can't handle them, and there just isn't a structure in place in the school to handle them. So if you kind of walk through a school and sometimes you'll kind of see boys like this just kind of walking through the hallways. But so to answer your question, the underlying mechanics are really the same as they get older. It just presents itself differently, different issues.
Right. What do they look more like?
So like I said before, it's breaking rules, but just rules that are for older kids. It might be punching holes through walls. It might be really as kids get older, they're harder for parents to physically constrain. Like if a kid is 6 or 7 or even 8 or 9, but if he's relatively small or not big, if the kid gets out of control, the parent can physically restrain him. If you have a teenager, he might be bigger than the parent.
Right, sure.
I've even had that with younger kids. I've had like 10 or 11-year-olds who are just big kids.
Right.
And let's say, even if the father might be able to physically restrain him, the father isn't always home.
Right.
And the mothers they're scared. Like, my kid is big and he could really hurt me. So that's all the more true as kids get older. But really the fundamental challenge that the children have and the way that parents can deal with it is really the same. It just changes in the content of how they do it.
Right. So it sounds like the approach itself in high school and adolescence is pretty much the same, but calibrated to something age appropriate. Am I getting it right?
Right. The only thing I would add with that is as kids get older, they're more of a candidate for individual therapy also.
Oh, interesting.
So I don't really see kids younger than 7 or 8, because I just, in my own limited experience, I haven't found it to be so effective. As kids get older, 9, 10, 11, especially as they get to teenage years, they have the cognitive ability to have a discussion about the issues. Once they get to that point, then they're a better candidate for therapy, because you can have a discussion, you could develop a relationship with them, and over time, if they trust you, you can help them with skills to be able to regulate themselves better. These kids, very often, this happens so often. Like, I'll meet with parents for the first time, and they'll give me a whole laundry list of problems the kids have. Then they'll say, "Well, my kid is a good kid."
Right.
And my answer is always the same. I've never met a kid who's not a good kid. Every kid wants to be successful. Every kid wants to do the right thing. Every kid wants to be successful in school. They want their siblings to like them. They're struggling. When a kid is 6 or 7 years old, they're not really a candidate to have a conversation in therapy about it. But as they get older, if a therapist can develop a relationship with them and they trust them and they can see that the therapist is not just another authority figure, but someone who actually cares about them, they may be more open to hearing, okay, what can I do to change my life? Because, they're not having a good time. It's not fun for them.
Does ODD persist into adulthood?
So I don't think the diagnosis of ODD persists in adulthood. It might. I don't know so much about the way the diagnostics works,
Right.
But the underlying mechanism certainly can stay there. right? So it just might come out differently. So let's say somebody, let's say you have a teenager who's aggressive, right? So he might learn as he gets older, okay, I can't get away with this. Maybe he was arrested once, right? That certainly happens, and that could be a wake up call, like I can't do this, right? But at the end of the day, why did he punch that guy and then get arrested? Because he couldn't regulate his emotions. He didn't know how to express himself. So that's not going to change just because you hit 21. And so that that dysregulation might come out in other ways. So you might have other problem behaviors, addictions, interpersonal conflict, trouble with social skills. All of those things could persist, even if the outward aggression or defiance has gone away just because of maturity or he's gotten older.
What are some common misconceptions about ODD?
So I think one of them I already touched on, which is it's not bad parenting. Parents
Right.
aren't doing anything wrong to cause children to have ODD. There's something about the child's neurology, that's making them struggle with self-regulation, but it's not the parent's fault. They're not doing anything wrong. They're every parent I've met is trying their hardest to be successful with their child. So it's not their fault. But again, it's a hard pill to swallow to say this is not my fault, but at the same time, it's in my hands to change it.
Right.
In DBT, which is a form of therapy, they call it the dialectic, right? Two things could be true at once. It's not my fault,
Right.
but I'm also able to change it.
Yeah.
A couple other things is these children, like I mentioned this before, also they're not making a decision. They're not waking up in the morning and saying, "I want to be bad today. I want to annoy my parents." They're struggling, maybe just as much, if not more, than the parents. They don't like it. They're not happy with themselves. They very often have very low self-esteem. They have very often they don't have good social skills, and it can be a little bit counterintuitive because often they're the leaders that amongst their friends. They're strong. They're independent, but deep down, they don't feel good about themselves. They understand that there's something different about them. And if you catch them in a calm moment when they're able to reflect, and if they trust you, they'll tell you that like something's wrong. That doesn't always happen. Very often they're not able to say that, but
Right.
it's not because they think themselves as perfect. It's just they can't admit it. But they're not
Okay.
trying to do the wrong thing. They're trying to do the best they can, and they're struggling, and they need help. And sometimes for parents, that paradigm shift can help. Like my kid isn't a bad kid. He's trying his best. He just needs something different from me. One other thing I would say is when you see a child in a particular setting, don't make assumptions about them because of that setting, right? So the fact that you see a child behave in a certain setting, let's say at school or when they're at your house, if you can have a play date, doesn't mean this child behaves this way everywhere else. Like we said before, it only shows up in one or two settings. I've heard so many times, like I've even seen, like I've worked with kids in school for a while, and the kids, like I almost ask myself, why is this kid here? He seems like an angel, and then I find out that at home the mother's at her wit's end and she's ready to give up on the kid because she's so hopeless. So just kind of like keep an open mind, when you see children, and understand that things aren't always as they seem.
What looks like ODD but isn't?
So there might be a few things, and the first one's probably more your area of expertise, Shmuel, which is ADHD. So
Right.
sometimes kids aren't being defiant; they're impulsive, and they
Right.
really want something, and they're not. Sometimes they're not even hearing what you're saying.
Yeah. That's true.
A few months ago, we had this issue with my daughter. She's 3.5. We would ask her something, and she wouldn't respond. We'd ask her again, she wouldn't respond. We'd have to ask her like 3 or 4 times, and finally she was like, "What?" And it's strange because it was a little bit out of character for her. And then we took her to the doctor for, I don't know, my wife took her to the doctor. I don't remember why. And it turns out she had a ton of fluid in her ears, and she couldn't hear properly. So like I was convinced that, okay, she's ODD. She's not listening to me. I got to start creating a behavior plan for her, and like give her a punishment every time she just couldn't hear me. You know,
Right.
so that's kind of like maybe you could speak to this more, but like, sometimes it's not that they don't want to do it. They just, for whatever reason, they can't.
Right. Yeah, for sure. With ADHD, very often the directions that work for somebody else are not clear enough for them. So you tell them to do something and they procrastinate, not because they're choosing not to, because they don't really know how. They haven't understood what you told them to do. You told them to clean their room. They just see a messy room as an avalanche, and they know they can't fight an avalanche. So they just, and often they're very cute. So they'll be like evasive and funny. And you're like, no, can you just clean your room? And it turns into a similar dynamic to what, doesn't have to be an ugly dynamic like you were describing, but it can be like a dynamic with a lot of friction,
Sure.
for sure.
Well, I'm just curious, what's your approach with parents when parents say my kids, aren't following the instructions? I'm asking them again and again, and when you feel like the ADHD is the issue, how do you help parents with that?
So the biggest thing with the ADHD brain in this regard is that the ADHD brain sees the world in two time zones. There's now and there's not now.
Hmm.
So you want a reward system that has something as immediate as possible. So for example, like you mentioned before, checks, stickers, charts, if they can see the reward, that goes a very long way. Positive reinforcement for kids with ADHD is much better than the negative. They're looking for that dopamine hit. So the dopamine hit works if you give it to them. With older kids, even the high five, the fist bump, the praise, something, that tends to help. So for these sort of behavioral things that you need to get them to do, the chart is good, but it has to be visible, and it has to be something that engages their interest that way.
Right, right. That makes sense. Yeah, I would add also, with PMT and the program that I use, the idea is to be like a good, 70 to 80% on the positive reinforcement. We really want to, the term we use is, we want to catch the good behavior. Like it's understandably so. Parents tend to miss the good behavior because when everything's going good, smooth sailing, they can do their work, they can focus on whatever they have to do, and they let the kids be because everything's good, everything's calm. It's only when they're screaming in this chaos, they got to run and take care of what's going on. So just, naturally, um, the negative tends to get reinforced more. So part of what I do is help parents. Let's really be detectives. Let's catch the good behavior as often as we can, even if that means creating it, like with the role plays, and
Right.
really heavily reinforce it.
Oh, very good. So it sounds like the positive reinforcement should, you can't create more frequency, but you can create a positive reinforcement that's more impactful, meaning that's more exciting than
Well, I
the
think I think you can create more frequency. So, for example, there's the role plays,
right.
right? Which is the child following directions and getting rewarded. That's the parents. It's an artificial, compliance, so to speak, but it is a compliance nonetheless. The child is doing what he's told to be doing. There's also just being more mindful, which again is difficult, but to really pay attention to when my child's doing the right thing. And part of it is also setting the kid up for success. So understanding their limitations. Like if we set the bar too high, they're never going to be able to be successful. So especially as you're starting out, set the bar pretty low. Make it that success is easily attainable, and then over time you can make things more difficult.
Got it. Okay, it's very good.
I would just add, you asked before what looks like ODD but isn't. Two other big ones are anxiety, and then children who are on the spectrum. So with anxiety, they're not saying no, or they're not, being oppositional because they're making a choice. I mean, maybe it is a choice, but it's not because of that power struggle between the parents. It's because to answer yes or to do the thing the parents telling them to do makes them very anxious. And if that's the case, then this program is not for them because that the anxiety has to be addressed.
Right.
Reinforcement is not effective, at least in this method, when anxiety is the issue. And when you have children on the spectrum, so this system can still be effective, but it's just important for parents to recognize it, and if it's a therapist, to recognize it, and then adjust things, to their ability, because they have certain abilities and things they're good at, things they're not good at. So just to kind of adjust things to make sure that we're not, that we're tailoring the program for them.
How common is the ADHD ODD combination?
It's very common. I don't know exactly. Exactly how much? I guess I could tell you, like, anecdotally, it's probably about half at least of
Oh, it's
the
very
of,
high.
of the boys that I see. Maybe a little bit less, but probably somewhere around there. I don't think that ADHD causes it, but I think it certainly fuels it. Like if you already have, a hard time regulating yourself, ADHD just makes it that much more difficult.
Right. So what does that end up looking like?
Let's say a kid's at home, right? And he sees his brother with a toy and he wants it, right? So, a typical quote unquote child might ask his brother, can I use it when you're done? Or they might
Right.
go to their parent and say, can you buy me that toy? A
Right.
child who has a hard time with self-regulation and or impulsivity might just grab the toy, right? They're not
Right.
going to
Sure.
think first about what's going to happen. They're just going to grab it, right?
Right. Yeah.
That's kind of like just a typical example of what it might look like.
So how does that affect, the approach to it?
When there is ADHD, then the ADHD needs to be addressed, right? So whether it be medication, which is kind of like the first line of defense, very often parents are coming in either having tried medication and it wasn't that successful, or it was, or sometimes it wasn't successful at all. And in that case, I encourage them to see a psychiatrist, try to figure out a way of finding the right medication. Very often that can have a significant impact. The only thing that, and again, this is anecdotal, I'm not a psychiatrist. The only thing that I've been told is, if a child is very aggressive, right, to the point where there's a safety issue, then to give a medication that's a stimulant, which many, as you know, many ADHD medications are, sometimes it is a little risky because it can cause them to become even more aggressive. So that's a question more for a psychiatrist to figure out, like, is it safe for the child to be on this medication? Maybe they need a non-stimulant medication. But that's the first step, is to make sure that they're being medicated properly if medication is warranted. A lot of parents don't like medication, and that's a decision for parents to make, not for the therapist to make. I'll never tell a parent, your kid needs medication. Like, that's not for me to say. And sometimes they don't. Sometimes children with, who have behavioral challenges are not ADHD, and they just need kind of a straight up, parenting approach. But when ADHD is the issue, then it certainly has to be addressed, whether that be medication, whether that be with someone like you, Shmuel, to help the child manage the ADHD. But it certainly needs to be addressed.
The treatment of the two conditions, I guess, does one condition exacerbate the treatment of the other condition?
I would say certainly I've seen the ADHD can make the behavioral challenges worse, because again you're taking away that moment to think. Like, I've asked this question to some of the kids that I work with that are a little bit older, and I'll say, you did, a whole bunch of things this week. We'll go over how the week was, and I'll say, if you had a minute to think before you reacted in each of those situations, would you have made the right decision or the wrong decision?
Right.
Or I would ask, would you have made that decision?
Right.
And almost always the answer is no, if they're being honest. And so I'll say the issue isn't that you don't know what to do. Right? You know that you shouldn't, hit your siblings. You know that you shouldn't slam the door, in anger and break the door. Right? You know these things. It's not a matter of knowledge. It's a matter of self-regulation, being able to take time to calm yourself down and make the right decision. So that's something that, when a child has a hard time with impulsivity, so it just makes their reactions that much quicker. I'm not an expert in treating ADHD, but I would imagine that, if they're working with someone who is, and they're able to teach someone to be able to take time, maybe be mindful and be able to, delay the amount of time between, or extend the amount of time between, here's the situation, here's my reaction. In most cases, that'll probably help, them make better decisions, even behaviorally and self-regulation wise.
All right. Yeah, that's the thing we do sometimes. Try to figure out a way to still for a moment to give you some time, to give someone time to think before they jump in to what they were about to do. So as we start to wrap it up, what is something you haven't mentioned yet that parents or teachers can do to be more supportive of kids with ADHD and ODD together?
So I think a big part of this, is collaboration. When parents, teachers, and therapists work together, they all kind of get a better picture of what's going on. So parents get a snapshot of the way things are, teachers get a snapshot of the way things are in school. Therapists, we have kind of the worst snapshot because we only see, 30 to 45 minutes a week. Maybe if we're seeing the parents and the child, we're getting an hour, hour and a half at most. So it's really it's the therapist's job to speak to the teachers and get the information, understand what things are like in school. It's kind of on the parents to coordinate that. Parents have to give permission to therapists to speak to teachers, and really, a therapist's role in this can be to help teachers understand, here's what's going on with this child, right? Here's what you can do to help him. Some teachers are open to it, or some are open to it. Some aren't, and that's an individual decision. Like, I'll never call a teacher and say this is what you have to do. It's more like I'm here for you if you want me to give you some suggestions maybe on what would work with this child. That's what I'm here for. But again, you have to respect the fact that this is a teacher, this is a Rebbe, this is their environment, and you have to kind of be humble with that. You have to understand your place.
What's a message of hope you can leave our listeners with?
Message of hope. I guess what I would say is there are children who I've seen who've come in, where someone in the outside might describe as totally out of control. Kids that are even on the brink of not being able to stay in the home anymore. There are parents who have to make a decision sometimes, like I just can't let this child, stay in the home. And I've seen those kids really be successful. It takes time. It takes a lot of effort on the parents. It takes a lot of effort from the kids' teachers and Rabbeim, because they're challenging kids to work with. But often these children also have the traits that make them very successful in life. They're creative, they're independent, they're outgoing, they're driven, they're strong, not just physically but emotionally. They have capacity to hold a lot and to deal with a lot. So if parents could stick through it, which they do, often there's a very nice reward at the end. There's a nice light at the end of the tunnel. But that being said, it's very challenging, and I would hope that if someone is not a parent of a child who has behavioral challenges, and they see someone else's child going through this experience, right? Oftentimes these things happen in public, like your kids are having a total breakdown in the store, or at shul. Don't be judgmental. Understand that it's not because of what some of the parents are doing. This child has a particular challenge. It can happen to anybody. It's not, there's nothing wrong with this child, nothing wrong with this parent. It's just a challenge that Hashem gave them, and be there to support them in any way that you can. But certainly don't judge them because they're not doing anything wrong.
Excellent. How can people get in touch with you?
They can email me. I guess I can. Do you want me to give my email address?
Yeah, you can put it in the show notes. Excellent. Okay. Anything else you wanted to mention today?
I think that's it. I think you did a great job, Shmuel. Thanks for having me on. This has been good for me to kind of like hear myself. I hope I didn't do too much talking. I don't really talk much in therapy, so this is good to get it all out.
Okay, no bill coming. Okay, Yitzy Wax, thank you so much for joining us today. It was very very informative conversation.
My pleasure. Thanks for having me on, Shmuel. Take care.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story, you can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.